but munkai bibi yayare sa ho nsem pass ye ka ho nsem a. And I always say it, and be be share will be make say there is no doubt say between MPP and NDC. MPP ya wadwempa ne mapa bebre mo my way na eto de bia nipa hofo no eti say one hwenie na one to boase a bon say ahofo na bia ema wo de take decisions bi ba edwuma pa de e be dren say your opponents between the omo ho atoto yen embra MPP edikan ye ba mu wo my way mu. Aya former President Kufuor or served between 2001 and 2000. That was the first time. Ghana had problem some bebre health financing. Ekwan first way share na problem some Ghana yaresa Ghana for to me ekomonim no opampeni Kufuor epegye mu. Health infrastructure omampeni Kufuor epegye mu. Make sure say ansa na yebedu 2008 no December no na Ghana bibia obeto ya pomodem nsem in the year 2001 no na akone nimbebre. But like I always say, where MPP won under President Kufuor took this country in terms of health delivery no anka ye bomodia at that time in the year 2009 anka ye fall for propaganda any twist any spin at that time anka ye pija ye ho kra ko prekope than where we were. Because by the time Omampeni Kufuor kono na niyema MPP 1 year na ka ye set ye ho on the part of growth and health no na 8 years na ya no be die no no man say ni nyina, and I'll prove that to you tonight. Me prove a friend say sir points that me making to you tonight, and the point is that we as a government, as an MPP government, as an MPP political party, on every ground, from health infrastructure to health finance and we have done way better than the NDC ever did. In fact, Omampeni Kufuor's administration is focusing on upgrading healthcare infrastructure. That was one of the focus. EBCC hospitals, ACC clinics, ACC chips compounds, ACC polyclinics. If our hospitals were by an or refurbishing or uplifting, he put a lot of effort in ensuring say medical professionals on training and to keep them in this country, you know, a lot of our medical professionals, they didn't want to go into the hinterlands. Rural communities. Omampeni Kufuor had to put in place a lot of interventions to ensure say they are attractive for them to go. In fact, he put in place a lot of campaigns and interventions. Not certain diseases and illnesses be how my way. You know, he had to do so much work to ensure say before Omampeni Kufuor ebeba abetena konyaso na MPP abetena konyaso. If you recall, on my way na maternal mortality statistics on maternal mortality. In fact, that was a time you'd realize say your kind budget parliament mamifo any ye mamenum dodoa eko awoso mu ye no finance minister begina parliament na wabobo na wakase afili ye ade o na percentage wu ye no than the previous percentage. That is how bad our health system was, and it was purely based on one reason. The reason was that we had a very poor system in this country. Say wo kwako wa unisika udebetria doctor no and a hospital no real time obede fie nti na awofo ne bebre ye mamenum bebre no awoka na odademu odampaso ochem obechema kopem se moje tunu ama ontumi ye ho hwe na fe de America se de ne hospital wahwe ni obedo na obedu hospital no no ma hwe omo nkwa nti ema quack doctors ni omo mojeji awo fie ni nkrasa na ebedoso. Why? Because the cost was too much. That was the days of cash and carry. That were the days and now crazy went to the hospital and it cost a lot of lives. In Colabre, we still bet. In fact, at that time in this country, I walk said hospital a country and then pipe. And Omampeni Kufuor realizes that we cannot run a country like that. Until quickly, they free maternal care And what free maternal care basically did was that making sure say on my way mu okwakowa ehun hia say obe physical prekope na ode akọ hospital akwakọ aban etua saka no emaw se ne be ya wankasa obetumi akọ without any difficulty. But monkai bibi the same people omoni e prayer konwe ne yanom omoni e prayer konwe ne when this free maternal care was being introduced at the time ayedeba on my way, they said it was not possible, but we did it as a country. And on my Penikufo at that point realized, if we are going to improve on our health situation in this country, then it's not just infrastructure, it's not just putting up training schools, it's not just training doctors and nurses, but we need to ensure that health financing is dealt with once and for all. Send your beya, see a kase on my way, ya pomudin husem kwenimwa. Health financing and so ekano on my fini shasiye as a 2001 mampininku for by na Ghana on my way or to dream or how be billionaire there. So a lot of people were struggling to even fend for themselves in a day, and so this kakọ de beko ayaresabia, and so you the cash and carry. That was the time I said oko now kunya accident near foul every accident in the Dukudu hospital na doctor for the monsa to tubutum na omo inyeska adebechi we nisu better na o wasamando webu, because you needed to pay at all times before you are taken care of. And then Omanpeninko decided, say no, we had to introduce a national health insurance scheme. And this national health insurance scheme no significantly changed the face of health delivery in this country. It is a deadly cash and carry system na NDC for jatana on my way consono. It be free ho. And for the rest of our lives, since that time till today, you know, the lives of our healthcare delivery, the lives of the Ghanaian person when it comes to health services access, you know, has never been the same. But of course, as usual, like it always happens, when the national health insurance was being introduced, you know, these same people, these same NDC people said it was not possible. In fact, at the time when your parliament, I pray, if any say, I pass a bill for the National Health Insurance Act. Omo boycott here. In some baby no kafa. They said we are just almost say MPP for year to turn foot regu penny. And yeah, they are so until we introduced it. They said so many things. They put up across so many things. This is them. The minority boycott proceedings on health insurance. 31st July 2003. The minority in parliament had decided to boycott federal committee proceedings on the national health insurance, which began on Tuesday. And they were telling us at that time, say, the decision to boycott national health insurance, you know, was in the interest of the people of Ghana, and that they are protecting our interest and defending the interest of the people of Ghana. This is what they said. And there are points, and they say, on my Niska at that time, I had the health insurance. Inti omo de omo inform nka ho ade inti na MPP aban beka se ye be for mine sika na ye de tua Ghana ni bia obekọ hospital so okopa yare say de tua no ho ka, so they will not agree, so they will not support. Let it be put on record today, tonight. Like I said, on the next chapter show, it's fact only that in the year 2003 ana MPP aban se ye de national health insurance eba at the time ana cash and carry kum Ghana for. At the time na cash and carry essay on my way yasero NDC for 31st July 2003 Thursday minority boycott proceedings on health insurance. Reason they say protecting the interests of the people of Ghana and defending the interests of the people of Ghana. Why? Because according to them, on mining niska to their health insurance, and that any possible that say on mine betunia for nisika now. Ghana ni bia yare our hospital ni etua nka almost say possible to member so into omo they didn't want to be part of it. That is what the NDC and their followers did to us in the year 2003. They even went on. The NDC accuses government of deceiving Ghanaians. I say the National Democratic Congress on Tuesday accused the government of deceiving Ghanaians on the National Health Insurance Scheme. The party said the government was in haste to pass the bill because the pressure from the IMF to fulfill the agreement has reached with the fund to include a 5% increase in the VAT in 2003 budget. To achieve this, the MPP imposed a 2.5% VAT on petroleum products. Hence, the near 100% increase in the price of petroleum products announced in January 2023. Moses Asaga, spokesperson for finance. So this is it. Omampeni for the MPP abai who say adenti ina yare ghananews sorti bumpurugu se ote sugakope se ote asin so ote twifu praso na wako ayaresa be nyuma me no ka say awuti fie ubusu eni bi ebia owe krum na ne ho aka na empofrim ese ye de ne ko hospital according to the NBC no ese nipa ne wo sika hye ne ho obetumi di akọ hospital na wetumi de tuaka anye saa dia emeyemfa oman ni sika nhwe oman benu ko fase de bi ene say yi ade ne yemo bia contributing kakran ne yemfa mbebom ne yemfa to foto bi mu se ne be ya se wo yare a na wokọ wan yare a ye de wo so foto no wo so de na ka obi ho ene po wankasa de ne sa tu botomu wokoto nsu a ye de kakra vat kakra to so wokoto jena ye de kakra to so na etumi aboa na Ghana ni bi eti bebi etumi nyaaresa because ebusuafo dia ye ko be nyina yi ye nyina be gya tum se bebi eni wa esen ayaresa school nya ensen ayaresa eduma nya ensen ayaresa ye chiche sika ma okra emu nya esen ayaresa. Everything we are doing, the ultimate of everything we are pursuing as a country, to ensure say we have an efficient, effective health delivery system that would ensure say wo aname and I yebusu eni bi muka immediately no ebetumi ahwe. But the NDC kicked against it. That is how bad the situation was. And to be, if you pay close attention to the NDC that we are seeing today in 2023, you'd realize that 2003 almost yet different from the NDC we are seeing in 2024. The same people. So you see, and I'm kicking against the policy view. It is out to say NDC4 are kicking against free senior high school in 2016, 2017, 2008. And many young woman, omo nananum saa no ye 2003. Omo ancestors saa no ye in 2003. It is almost 4 years in 2024, 2023, 2017. You should not be surprised. And remember what they said in 2003. They say almost kicking against national health insurance because they were defending and protecting the interests of the people of Ghana. And these are the same people causing all manner of difficulty for this country in parliament. And the same phrase we are defending and protecting the interests of the people of Ghana. Now look at this. 2008, 5 years later, 5 years later after they told the people of Ghana say health insurance MPP ain't to me yet MPP say chechira ye be ye no omo say enwu nya enfaso bi e so ye mamu kwan na mo introduce friend say VAT na find ye health mo bia into me nya so enfaso. 5 years down the line the same people when afedi omo who say Ghana for ni age health insurance no cash and carry free ho mamefo e kwa wo so e ko ni free nkola dodo a ewu a wo mu e kofem mamefo a omu a wo so e kofem Ghana for pomudin sem na ya resasem e kosro no all of a sudden quickly ye kotoaba August 2008 akabaya 6-7 months bi abato obaso enti NDC for na omo kicking against health insurance no this same group they come back and they say NDC to introduce once for life insurance premiums. Can you imagine the hypocrisy, the inconsistency, the contradiction, the deception, and tro and kontopo and nada kokofu bobo subaino efri omo nananom na abedu omasefo aye kan wonsem. So you see the connection. Enti enei say what is NDC ni catch us say free SHS na you say 2008 ye demonstration tia no 2008 ye advert makomako 40 tia no ene omo catch us say yes remo free SHS no ye ditum ye ni free SHS no ya adwen montuma yes remo ye ba ye fa ye sanka. The people who said they will cancel free SHS, the people who kicked against free SHS, the people who said free SHS was not possible. First almost say enya the papa ye bo mode e de buy na fe do mo say ade no kwa enye fe afi do mo say quality ne kofam exam results ne buy na nkola na ya ade no afi do mo say o nkola no kwa mu wi aye. The same people now akaba 6 months ekotoba omo nam nkrase omo na mefie afi de so free SHS no krade yes ye ba ye beto so ye beye the same scenario na mentwe madwen ko bribi so eto de bi na ye ka bibia enye se bia ye pese ye ka ne ye ka keke ye ka kire mo say the NDC kicked against free senior high school so if they come and tell you say on beto so boboa me di ye change in the year 2008 after NDC had kicked against national health insurance they came back almost signed by BM on the catch Ghana for 5 years later because we say Ghana for near Jehon this is free SHS ye de bomu kiki against after the one say Ghana for near Jehon into mo na no so after ye beto aso ye de bi kra be ka ho ye de private schools be ka ho ye de we be ka ho they came to tell the Ghanaians 5 years later after kicking against health insurance say after the oh ade no kra munim e ma mo worry ye de ye ba health insurance na eba na ye kutia ye na ye se ye mpe no after the mo nto abama ye sremu se mutoma ya ye be mo tua premium ba kope once pe utua untua biem omo yes our promise no in 2008 it's in their manifesto Mr. Mu 8 years of NDC in power because it was based on some of these lies and ye to abamo Ghana for say health insurance ya the papa wu nemu ya na renewals no na premium no e ha adwen 12 cedi 14 cedis no e ha adwen nti no obi say obo be no one time there oh we mo no mo de ba be yen form ntina nchen ne yen toma we mu so we actually voted for them based on that after we voted for them Ghana for 2009 emba 2010 emba 2011 emba then Ghanaians got angry mo be kaya and I go first started say na health insurance one time premium na wo he mo share bo mo fambe because I can tell you without any doubt say Ghana for school some any of my yare sound some endiagro it they were very keen on it and Ghana for started to me say one time premium na mo share about 2008 no yes some fambra they couldn't do it they were lying they didn't believe in it it was false it was deception omo chantro no mo yigide bia om no mo dada Ghana for enti afa no 2011 Ghana for pressure the course na afa do mo say NHIS please go back NHIS to be introduced as a NHIS one time premium to commence. This is 17 November 2011. The one time premium payment policy under the National Health Insurance Scheme will commence. The Minister of Finance and Economic Planning Dr. Kwabena before has stated he did not give the specific date of the implementation, but it is certain that the project will be implemented by the end of 2012. Fellow Ghanaians, as at the end of 2012, Anybia na NDC4 at the one-time premium abana. This is the finance minister speaking in 2011. 2012, they came to give us more promises. Return of cash and carry, NHIS is broke. This is December 24, 2013. Until by the time you year 2013, no more for one-time premium number. Almost good health insurance. No. Until December 24, 2013, no, now a lot of Ghanaians with the health insurance and the core hospital are useless. Now health insurance card, no, if I should be any so, and to me here, they collapsed it. The same people, into Osha South tangent here, Yekui. Now Osha Omasifo, and they are any more, yeah, they are much share acquiring to me your Moshi. Do you see any difference? Do you see any difference between the NDC in 2003 kicking against health insurance? And then 5 years later, coming to lie to the people of Ghana and say, oh, I didn't pay. You back one time premium. What is the difference between Omasifo and Omodeli CCA? They kicked against free senior high school, fought free senior. In fact, NDC4 denigrating Omagu free senior high school mufi SCOBI or my way. Then to 2024, Yekotwaba, Omagu said Ghana for only John. All of a sudden, they are promising us an enhanced free SHS. The people who said free SHS was nonsense. The man actually told us, say, "Ono no kra 2 billion cedis anka. Oh, from Korea secondary school education free." He said it. It's on video. And then wasiaba. And you made Dennis. And you made miracles. And I made that TV so the man catch her say, "I didn't know all kind of dada wo." Me chere odi ane nananom eyeye. 90% of omo mudi said you mudi ye boni from 2003, 2008. To 2008, 2011, by fighting free senior, fighting national health insurance and coming back to deceive us. said they were going to make it one-time premium, and having 8 years and never do it, you know, they are all part of the same group. Or more difference, the same people. So today, if they come to you and come and tell you stories about all the fights they fought against education, and now come and tell you, say, they all of a sudden believe in the thing they fought against and say they will never invest in the judgment is yours. They can't be trusted. They cannot be trusted. We cannot believe them under any circumstance. At the end of 2008, Omampeni Kufoni MPP are buying based on NDC phone training contopo on the buy NT. Ya two about TI, at the end of 2008, non national health insurance can't afford to do a waso. Answer Omampeni Kufoni connect 12.5 million. 12.5 million. Ghana phone Bakumako 12.5 million in an Omicron national health insurance card or medical hospital. It tells you how important this policy and program is to the people of Ghana. Unfortunately, by the time I am promising a one-time premium, I ain't am I a 2 about 8 year a buy now or the other buy another will be mono. By the time I almost call in 2016, 8 years one time premium no more bed that ain't here may 2 a buy no don't buy no they didn't do it. 2 no more good into 12.5 million no now membership no reduce it from 12.5 million to 11.3 million, almost 1 million. And now if free health insurance because now health insurance already no obekaya news na made 2013 it was completely dead. Card in the ukura oh by the hospital useless. Now I can tell you, and I'm pleased to announce to all of us, and the confidence level in the national health insurance, Kufo asefo, Kufo ma, yesan baye later 8 years later, yesan baye no, yesan be peja ne nu nyamu, and na me no kase as a matter of fact, as a matter of data, facts and figures, national health insurance enrollment, a peja equals 17.5 million. Into which you betono at 11 million. Next year they almost about 6.2 million. And they are back home. Into Ghana for 6 million. And it will be GDA. The current health insurance system and into Omakoji Kada Omo Edomu Hababedomu. So the difference between the NDC and the MPP when it comes to healthcare access, creating healthcare access, creating the space for the Ghanaian person to access healthcare no clear. Ye na nanom ene omo na nanom hia in 2003 no ye yesin ye twa omo ene yasefo okofo asefo ne omo so masefo be hia no difference no enie yasan etwa omo. This is our scorecard when it comes to the national health insurance scheme. Ghana for do omampeni kufo ejaye 12.5 million okono na omateso about 11.03. Yabaye no enuma ya ye ne, and let me put it on record. Enye niema ye pese ye about health insurance nyina na yetumi ye. Still there are teething challenges and teething difficulties, I can tell you that. But still, in spite of all the difficulties and challenges with the delivery, any acquire Yama health insurance card no more who de na caution, very clear. The confidence level that the Ghanaian person has in the MPP's health insurance versus the MDC's health insurance, obvious. And then somebody kaya, and I'll play a video shortly. I'll play a video for us to see how Ansana MPP are buying new second into card now expire at once. And they say we'll come back to cash and carry because it was going to take you about 3 weeks as a way to renew your health insurance card. In Komobi wa would need yeding. As someone in the Muken, what would if you are with me? You are very much aware, say, some Komodiano need DA and yeding. Everybody knew, say, before 2017, now we could renew your health insurance card. A manual, Obako did line, tin, by one, friend saying 2, 3, 4 hours. Now it will say productive economic hours. As a way to renew card, and require 3 weeks. As our card, then on Saka, and then a instant, a digital, a short code. In fact, what the doctor now and nurse in any OPD now on the Casano say, or file card, not say, one say, hey, we have fear, some renewal, Mr. Ramo, no 30 seconds.
These people have been queuing for hours to sign up to Ghana's National Health Insurance Scheme. A new instant biometric...
This is a video that was done years before MPP in 2017. And that was the health insurance situation. That was the situation. That was the situation. Enti say ye ka apomode ho nsebwa. Ense moma yi nyina ye clear say they are praying nyina ne tintini ne titia e apomode. And if you get that wrong, almost everything would go wrong. And we need to protect it. And health insurance when entwoma dwen bibi so yare dodo na health insurance shase na me fa ne say eye on the policy a ehwe no from 2000 to 2016 and this from yare ba akokora meka ho na che say yare dodo na wo yare do a say yare bi wo ha na health insurance ro kwa enkoba ne ade ntie so we de enka ho no for 8 years they did not introduce even one additional illness to it. Nti the member to ye na mutina ho anti yare ahodo na ke say ye ko eri na epia baso nkakra and me no ka say under this government ye cover 95% of diseases in this country. 95%, about 95% of diseases in the country is covered by the National Health Insurance. Na Mr. Mo, and then you the kidney abeka ho, and then you the childhood cancer abeka ho, leukemia, worms tumor, sickle cell you so mu wo eduro bi you the man kola na sen kola no wo de eduro no mo a etumi boa na yare no mu nya seasons ni ade edidi ma me hwehwe de na me mbo na nyire hu what's the name of this hydroxy urea. Let me share one for me. Hydroxy urea. Almost the deal no doctor for the better here. Hydroxy urea. And this hydroxy urea no area very crucial and critical. And can say you to me the ma and kola all this about we never did. And then nyame ncha de nyame adaroma. Aban na moto abama no 2017 no. Ebusuafo. Omo no ye pray na say ento abama mo de zero omo fe bi anka ho. Ene ye the kidney nkola wo below 18 years. Any pennyful war above 60 years. More aware to say Ghana ha in nam 18 years and then the draw super they are covered under the National Health Insurance. And the dialysis near they are covered. Cancer in Kolei, edu baby. In fact, better pictures, images kakra. Mr. Mu images we no kakra inti mo fancheme. But mommy yasha images si kakra. Ni ntias ye pa what it means for these people who can now have access healthcare under the health insurance scheme. Inti wo hwe enkola yi ne yare sronku yi a se oyeni ba ewo ekrasi baby na akola yi yare but omo sense screen pictures ni biom akola yi yare se ne ba enye ne photo true no photo of his ne ba ewo sa yare yi bi na health insurance enkoba. What is these parents going to do? What are people like this going to do? What are parents like this going to do? citizens of this country who find themselves in this situation, what would they be doing? When mo aye nyame bi a ese say you to your boss near dream near process it must influence our decision in voting. Because about one room, and you want to send the board by cancer natural bush of war. And you want to say, about then the Panama say, we know Casobe 10 went to me and went to me into Mufamame. Now, we know who can say, Oba Bayano, what is zero in the buyer. On the way to me, now. But on the 1, 2, 3, 4 now baby come. No think about 10. To me ye 10 ye no credit, but why 4? We ye 0. Inti man then can't change and say when to me 10 inti famaye. Change say or ye 4, but we ye 6. Or ye 5, but we ye 7. That is what should lead this conversation. And you did you. And ye kasa basa basa ninti mo name kasa entry name penifua ye kaso mo name debi. Ye purely based on the facts. Yes, say, and you know what health insurance we need to me. Nemum, see a share health insurance and common dear. The part do I have form to so and health insurance. Me no say there are some hospitals cry a buying sika is here the common when young koye a delay kakra a biakechi. It's true, it's there, but you're improving no. And my confidence that hospitals in the scheme no a cost row. Into one of the days are. They said I'm share 2013 Al Jazeera video ya nkofo so mo hospital yenje and our choir line 3 weeks and so be done card no etwem and then confidence in the cost into hospitals no omo je card no share there are companies and first omo use private health insurance schemes and then it's on the confidence level in health insurance nti omo use Ghana health insurance in the mom workers nti yen ka say the body na akoye because there are hospitals a bicycle say konim na nya nkoye nti there are those challenges. But the hospital need say, and by way, I improve this system to the extent say, obey to deliver service, because government is surely going to bring them the resources. And NDC for bar bemuno, or mampeni kufo jana 12.5, or what so called 11.3 because we share video here. People are tired, they are stressed. Say me renew card, now me did 3 weeks there, and then because you and a card no to me the hospital. That's a year in JDR. Then what am I going to do? Until they started dropping the health insurance card and living their life in the hands of God. And until the man numbers say and then you buy based on the confidence in 6 million. Ghana from Akumako 6 million. Data doesn't lie. 6 million and a confidence from more health insurance in Mono. A cost room to abedom. Adentia, Niamani Bene say, ya real do health insurance in the Kobano. Ye be a beck and this is for the Ankaho. And see, of course, if there are 6 million people who feel say there are diseases that they would need cover for, this is a government that cares for you. In spite of difficulties, in spite of challenges, it's a government that wants to be there for you. A government that acknowledges that we have difficulties, but I want to be care for you. I'm telling you, I want to be there for you because I know we have difficulties, but I want to be there for you at a point of need. Baby who are to me private health insurance schemes no ko check say mudu do say na say yare we krom card ne hwe private health insurance na e wo ho na baby na private companies ya de ko they don't cover these sicknesses and these diseases, but your government, the government you voted for to come to office in 2017 no, has brought this. Now this person that was keeping people 3 weeks before they can get their card with you under the NDC no yare born perfume now card yes want to go hospital it's all 3 weeks. Na 3 weeks no we card no for so be no also and then instant. That is a big difference. And at the NDC oman fa ya res foforo bia be card ya be to from oman penin kofo ho no and then ya the kidney abeka ho ya the childhood cancers ya ria ehu a ba wan hwe betumi ahwe wase nyina ahwe wajapade nyina ya ba beka ho enunti na numbers na Ghana for do omodom health insurance no ababeka ho, and this is our scorecard for health financing in this country. We are the big conversation, health infrastructure. We provide health care near the we provide finance near the at the biggest question is health infrastructure. And if I say yare bowa obeko, and if I obako pay ayarisa, and so extremely important. But me we efi video bi a very very important. Eto be bi a wo kasa na wa wo ka wasem a ase wa wutu ho. Next chapter yentu ye ho. Ye data any fact nkwa ne kasa. Mo me he mami Ghananews no AD health insurance ye ba beto ye no ho dance. Ye hwe no kran se ya to nkomodie no so.
No, me ba no ko hospital. O yale esada ha ya. Me kwa mi ni se me kwa ko tuya card me ya so de ma renew ne health insurance no. Me kwa ya no na Ghana ji o so de buy me see an. O ji o hwe so se kola no ofie se me so 4 years. O se abe ya adwuma sisi ya. Kwakwa a ya adwuma me ntua henda Ghana no. Etu omu ye ba omu ya beba. Omu ye ba omu ya beba. Yeah.
Enti ohwe mami ya ono kanasem efa ye health insurance ya wo hu adanse die no so hu 2030 adanse die no na hu 2024 adanse die no yento ba for progress yento ba for future yento ba madota Mahmoud Bawumia na onfa insakraya soronko a ebema Ghana fo hu atomo embra peni die yankasa wo ye peni papa na esa ho chene o hawo mawo but the difference between a good leader and the bad leader ne say baako ahoche ne ba no de nsa ko wiem me dead goat me odwemfunu minti obia de amoka na mebeti de ampe bia monye me emfa me ho kendi papa no one de ahoche ba oka nipa ni nyina ebum eboabo ye nyina no no say ohaw na ba amane hu na ba aha no metumi agumu kakra man yetumi akoyanim once we pursue the challenges and make sure that we fix them. A good leader is not the absence of difficulties and challenges. A good leader is a leader who, in the midst of challenges and difficulties, has the courage to mobilize the people and drive us out of these challenges into the path of prosperity. That is what Dr. Mahmoud Bawumia represents. That is who Dr. Mahmoud Bawumia is. And that is why confidently we are saying, let's vote for Dr. Mahmoud Bawumia for the sake of the future of this country. Health infrastructure. The records of the MPP government when it comes to health infrastructure, MPP 1, MPP 2, are unparalleled and without doubt. And I'll tell you why. MPP are buying yes scorecard in here when it comes to health infrastructure. Yes, scorecard in here from 2017 to 2024. This is our scorecard. Number of hospitals, 12. CHIPS compound, 1,737. And you know, say Ghana ha. Yeah, health center 5, polyclinics 15. When you say Ghana ha, yeah, health system no, yashe. At the basic level, at the electoral area level, is the CHIPS compounds. Hono, ena say uti paiwo, uyimaka okakra, uhodo ude meka na obeko. Uko do wana say ebro CHIPS compound for the swa, na yede woko health center. Uko do health center for no so na ebro muswa. Na yede woko clinic. Uko do clinic na bro clinic for no so a ni yede woko polyclinic. Uko do polyclinic na polyclinic for so ntumi handler ni yede woko district hospital. From the district hospital and far ni yede woko regional hospital. From the regional hospital and far na fi de woko tertiary hospital se Kolebu mu de keka ho. The number one most important and crucial health facility in here Ghana Media and the CHIPS, because the first point of call, and so it's very important. Now, this government has really focused on it. In fact, a lot of even government institutions, government enterprises, almost social responsibilities, they are pushing it into providing some of these CHIPS compounds and health facilities across the country. District assemblies are building it. In fact, National Electricity Authority, they are always building health facilities at the CHIPS level, at the electoral area level, from the GMPC Foundation, Ghana Gas, to say several of these state institutions, National Health Insurance and Kasakra supported districts to build some of these CHIPS compounds, and this government has built a lot of 1,737 of them. Okay, can Myanmar projects are buying within the health infrastructure space 2,043. This is our scorecard. In fact, agenda 111, and I will go into the agenda 111 specially very soon. And see, we are very confident about what it is that we are doing as a government. Without any doubt, we are very, very confident about what we are doing as a government. And that is why, you see, based on the IAE, and based on your scorecard, dinti, mo sheso na mo fanto aba emaye. These are some of the projects ye buy ye di ensaka, several of them in so-called hospital. And you see, there are some of the projects I bet in NDC for say ye buy any see any ye buy na complete fabrications. Plenty of them are complete lies. Bebre na omobwa. And I'll tell you, President Kufuor in the year 2008, I share project biase. Or share the Eurojet projects ase. You say, yem bebre I na yate Eurojet. Bebre na etas na NDC for to futuro normal kekansem. And I'll tell you something this evening. President Kufuor somewhere in November 2008, I share Eurojet project ase. Now the Eurojet project, basically all it was doing is to ensure say certain health facilities will be provided across the country. Certain health facilities will be provided across the country. NDC for buy, you know. NDC for buy is also a project. For the 8 years that NDC remained in power, between friend is saying 2009 up to 2016, no, omuja project in egu ho, ema Kufuor asefo. Ye answer yes sign by. Ebe we project. And it's quite painful and quite sad. Say, in spite of all of these things, you know, you still hear them. Still our better say kasa bebre, cancer makesi bebre. And these are projects that they should have finished in 8 years. At some point in Bono, sika omo koji some of these projects, you know. Omo diverti sika no. And the sika no koye election friend is saying research. And we'll come to that. That is the kind of people we have to deal with. And today, these same people will come and talk plenty. Yes, every government provides some infrastructural intervention. But I can tell you without doubt, say, what this government has done, it's way more than what the MPP, NDC government did. And I've actually shown a lot of these things in the table that I showed you. It is important, say, or mind be say, who provided health delivery amount you pay attention to two critical things: the financing part of it, and then the infrastructure part of it. We fix financing, no. Now we fix health and so. We fix financing, no. Now fixing health and so. And it's important that we keep our eye on these things. And we believe that as a government, we believe that based on all we have done and based on all we have tried to put in place for health infrastructure, no, we have absolutely every reason to believe, say, this government should continue to finish what it is that we have started. We should continue to finish what it is that we have started. And these are some of the pictures of hospitals abaye ya intervenia etumi I provided for us across the country. Infectious disease center Cape Coast, Okita Hospital. Obekaya, a lot of these facilities. There's a East District Hospital. There's a polyclinic at Segi. Polyclinics, we have about 10 or so of them scattered all over Greater Accra. This is the Yellow Krobo Hospital, and also is there. This is the Buipe one that I was referring to. It is several of these interventions have been put in place to ensure say empo say won touch ma ana won ka say wa monko bie say wa de na mame monko bie say wa de na mame say wa e didn't say wa we konongo but say wa. Look at the Sewa Hospital. They want for anything. An amazing edifice. This is a project that you can see 8 years. 8 years now come you. They didn't touch it. They left it. Kufuor asefo and a sign koya and buy and a sign be sa and this tells you the caliber of people that we have to deal with. Like I said, on the next chapter, for us here, it's just the fact and nothing else. And so once we put the facts out there, it is up to you to take a decision where you want to go. Yendie say we should move towards the future, and the future is Dr. Mahmoud Bawumia. In 2004, and this is a very, 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 very worrying situation. Mobekai May 9th disaster. May 9th disaster, just as it happened in under COVID, when we realized that we had over 88 district hospitals, Omuni hospitals. May 9th disaster here in 2001. That was when this country realized that we had an extremely poor emergency system. The emergency systems, you will say, at home, it doesn't even exist. In fact, we did not have any emergency system at the time. Until the year 2004, and our Oman for Eshasi, and again, MPP. The same MPP government had to come in and put in an intervention. Until in 2004, the National Ambulance Service piloted operations with about 69 newly trained emergency medical technicians. In fact, that was a time and we're trying to put in place a completely new system to ensure, say, Ghana, yebenya emergency system to me and Oman Peninkufor piloted this with about 69 newly trained emergency medical technicians, 9 ambulance. As of 2017, MPP na Ghana, we had only 55 semi-functioning ambulances. Not just say, your ambulance bako 55. But sa ambulance 55 for the crampono, and yen na na ye dumayi, and ye 55 yen na ye dumayi. Enti we got worried. Nana Danko Akufo-Addo realized that hey, we cannot continue like this. So throughout his campaign in 2016, he started talking about ensuring that we provide this emergency, we put in place a solid emergency system for the country. And that is why on 28th January 2019, Nana Danko Akufo-Addo commissioned 307 new ambulances. One constituency, one ambulance. Say, anye she krampono. Ne pape muno enkesi se boss sensa. But 55 abebire na anye djuman krade alabraka. Anye she krampono constituency biaro ese yenya ambulance bako. Na afe bigger facilities te se kolebu ni ade no yenya ambulance ne dodo. Into 307 ambulances and our mampeni Nana Danko Akufo-Addo introduced in 2017. In fact, say u calculate now we share the number of ambulances of Mampeni Kufuor introduced here. Now we share baby ane yewo. Now we imagine say it took the same MPP. Into Mampeni Kufuor the started ambulance service for the record. As a matter of fact, Ghana National Ambulance Service of the Republic of Ghana was started in 2004 by the MPP government. For 8 years that the NDC were in power, they did nothing to improve on the ambulance service. It has taken the same MPP government to come back 8 years later, and then in 2019 come and continue what Mampeni Kufuor started. That is why Mbibia Mekachemu say, let's allow the MPP to finish what we start. Because if we had continued from where Kufuor left off in 2009, and Kabiyesi Assembly in Kewebe 1,000 ambulances, because it had to take us to come back 8 years later before we could put these ambulance services together. Muhe video we mami.
Each of the 275 constituencies is expected to receive an ambulance by June this year.
The health delivery system will be significantly strengthened by the expected arrival in June of 275 ambulances, i.e. 1 per constituency, to make treatment of emergency cases more effective.
President Akufo-Addo says each of the 275 constituencies is expected to receive an ambulance by June this year.
The health delivery system will be significantly strengthened by the expected arrival in June of 275 ambulances, i.e. 1 per constituency, to make treatment of emergency cases more effective.
For the edible from Con in the mine. No crepa say with the so. Never in the history of this country have we had any government apart from the NPP government. Think about the emergency services of this country like we have. Imagine in the middle of the night at 2 a.m., 3 a.m. Now when you're emergency, now we need ambulance or district in the name. Then put ambulance or a hospital be there. Now we pay mwa see a foul. Yeah, what new year? Obedrin say asema making e we chichi na wo de entumento. See a numbers no. Near the Padodo ambulance service about from 2019 bepemune. Afibia eboa, it will tell you what we were missing for 8 years, the gap we created in 8 years. Gap we created 8 years, and I am my MPP abayan to us. Every ambulance service na yeshas, you know, it will tell you the impact, the number of people who lost their lives, the number of people who could not get access to emergency services because we didn't have ambulance systems, proper ambulance systems in this country. Districts do not have. The whole region, region in ambulances, by 2 and 3, is the regional headquarters. That is how bad the situation was for us as a country. In fact, within NDC 8 years now, we attempt to say, we provided some form of mobile emergency support. No, the Omukofa any. Kai I see we, and you be away no more sha. But this is what they did. This is what they did. They didn't fix the emergency health system. Rather, what they decided to do was to introduce a mobile clinic that cannot function. This is what they did. Meaning, say we out in the way or woman temuda, and I will put them with say NDC for car we or what every and maybe every da. But this is what it is that the NDC did when we gave them the opportunity. Take a screenshot we na print it na fashe frame na for board demu okoto aba 7 December my win kai na kai say enye nneoma ne nyina ene yeye yetumi aye nemu se ka win ko ade a anka mama yento aso na yemfa nepa emra ambulance emboa e de abrɛ no o me hwɛ video yi.
Ghana's public health system had been lacking many things, including emergency medical services. In the Ashanti region, one case that became very topical and has stayed with both paramedics and regional heads is how a pregnant woman carrying twins and in labor got saved, courtesy the National Ambulance Service. Central Front Plains District Chief Executive Joseph Jimfi Owusu first made that call to the National Ambulance Service on behalf of the distressed woman.
Ambulance afibia, in fact, average 28,000 cases an ambulance service handle. In Tebusia, bisa on say, Sanipa 28,000 ambulance abuomi. Say enye MPP are buying ambulance, one constituency, one ambulance here they buy here. What would have happened to these people? Please take a deep breath and ask yourself this very important question. Why did we wait so long? Why did we allow this to continue for so long before we brought the MPP back? Why? President Kufuor started this. There was nothing like a national ambulance service. President Kufuor started it with the MPP. The MPP came to you. We begged you. We asked you to let us continue. Why did we allow the NDC to deceive us? Then we voted for them. And then for 8 years, we had to endure. Painfully enough, we don't have statistics of the number of people who lost their lives because there was not a proper emergency service in this country. We don't have that statistics. Painfully enough. But if we had that statistics, we would have realized what we missed for 8 years. 28,000 every year. what would be the fate of these people but for the emergency services that President Kufuor introduced. Now this is it. This is it. 2009 to 2016. NDC are buying increasing stations from 128 to 130. That is 8 years. 8 years the 2 centers in the count 2 centers 2 centers no the count. MPP you're moving from 130 to 275. There are about 145 new ambulance centers, new emergency centers in our Ghana emergency services and all. Between 2004 and 2016, if you have President Kufuor MPP buy share National Ambulance Service say, 2016 and then NDC buying a free so now the total number of ambulances and you semi-functional as a one who be near 55. And now Danko Kufuor Daroma, MPP Abaya Daroma, and as a country we boast of 307 ambulance services, and that is why 28,000 minimum every year are able to get emergency services when they need it in the middle of the night, daytime, in the morning, in fire, rainstorm, to ensure say lives are saved and lives are protected. Responses. Now, in fact, every year, of course, because you have 55 semi-functional, you can only respond to 5,000 people a year. But you can imagine the number of people who needed help. Today, because we have 307 and more, no, 28,000 are responding. And no ama Ghana me no kase na your ambulance population ratio one ambulance a fanipa 524,000 one thing you am patch of a pen. Ghana as of 2016 na nipa 524,000 nipa 500,000 obi our ambulance back 500,000 obi our ambulance back patch one thing you assign 500,000 no be our ambulance back and then yateso nipa 84,000 and a use ambulance back you go so quick. In fact, the global standard ne say nipa 25,000 ebe here a use ambulance back into ambulance back to nipa 25,000 and then yateso from 524,000 over 400,000 reduction. Yeah, about 1 to 84,000. Dr. Mahmoud Bawumia say you better be aka ho or the dodo na aba beka ho obeshe mukena na yet to meet international standard no near if you 1 to 84,000 no nearby even below the 25,000. That is the next chapter of Ghana's emergency services. It's time to say adiolegu a good year during the period minti the number of employment and 1,651 no so tie hwem about 178 people per any ejuma within the ambulance services. And then me no can say with a revamped, resuscitated, revitalized ambulance service, you increasing number of people ejuma from 178 to 2,574. That is the scorecard for us when it comes to emergency services. Yeah, coming now. Now you another category and we hear power and also problematic, and I explain to you. Ghana ha somebody kaya na our credit to me short by your communities we are it's a remote area money adenti and I do not work no or call for no work no anti-snake venom na yede mana ne ho atono no ebi ni ho nti na owoka obi no wu anajo awoka obatan yede na ko chips compound yede na ko health center ye koje na wo odu ye no moje truna ma wa shoti moja ade ba ko pe ne saka obenya ye betumi esebi no anase ye benya no kwa eno eye moja esese onya na edisi ne so anajo de som 3 am physician assistant nurse wo ho oni moja oni yobeye from sa community nim Echo District Hospital now regional hospital over 15 to 20 kilometers ne kwan ye enti on to me nko enti na waka. Dr. Mahmoud Bawumia ni MPP aban say David, we have to be creative. si yentumi nye yakwa nyina wie preko pe ni yentumi nye niam ni nyina nya facilities amoja be wo Ghana ha electoral area bia preko pe dia. Can we be creative? And that is the point I make all the time about having solutions in the midst of challenges. That, of course, as a country, we are unable to fix all our roads at a time. What it means is that it's difficult to transport people from certain areas in the middle of the night on time to get the needed emergency service. So what do? Do we just throw our hands in the air? You give it up, Daddy. Yam pe kwan sunku bi e betumi afa so. Ye nya ye wo kwan no mpo. Se wo chewa ye betumi ahwe. Eno ene ma zipline e baaye. Na momi entie abra Dr. Mahmoud Bamia e bo zipline so e kire Ghana for.
In terms of enhancing access to the delivery of public services, in another 3 weeks' time or less, 3 weeks' time, we will see medical delivery by drones begin in Ghana of critical medicine, critical medicines and blood.
Zipline, ne say, wo e krebiase bebi ya ukrono wo e wonsuo bi agya e kwan gom untumi ntu kwan tentem so a say wo health center wo clinic wo chips compound empo district hospital bi ehia moja na de agye obi nkwa empo film na mekura mitimi fi ekwapem not tete kwashi e short moja na say ye hia moja na ye de agye nipa ne nkwa na say bi ni wa say e fa ambulance ni eto ambulance ne ban kan anase ye tukoko fodia ne yakofo moja na ba minimum of 30 minutes there e be bi as ya bedun kan ye package wi as ye de akọ until within 1 hour to 2 hours there ye be di as amefa ne se bibi esi ye kwa mu kra ye tuwenya moja aba be sini pa so 2 hours until there are people who are definitely dying within that 2 hours because they couldn't wait for the blood and no and a zipline e ba bedu mujuma until we need it aba for kwan bi aba ye di moja no ebesi anoma no so broni anoma drone broni anoma ye di besi so na edi moja na bro obia wo bia na edi ahwe. That is all zipline is about. Se panie bi na esi ede wo na ebi ni ho a ye mfa ka emfa nko bibia nkoje wo frɛ ewo app wo mo app no na zipline for the drone no ahye broni anoma nim drone na edi abesi opon ano pe na yede ahwe mo ma he drone e deliver niema and they deliver ndro e deliver moja ma some communities but mo bo sa video de mame.
The introduction of the zipline medical delivery services, some of the communities in rural areas are now able to receive quality medical services in time. The introduction of zipline medical delivery has positively impacted the work of health professionals in the area.
The LMD will request every 3 months. So after they deliver, if you need another drug, you have to wait for the next 3 months before you get it. But when zipline was introduced, things have been very easy. When we are in shortage of drugs or medicine, we just request and within 30 minutes, we get them. But previously, we didn't get any drugs, so we normally refer them to...
Nuna ba kokura mumbo video ya na nkola yi kwakogu mumbo sa video de mame enkola no ekogu mu a nurse fo kwakofa no mumbo sa video de mame na ekosi ho a na che se ena besi wi ena dafe no na nkola ya kwakofa na omo de akoma e friend say nurse fo na nurse fo kwakotam in a day for some hospitals, for some health centers in a day almost to make about 3 or 4 different deliveries. And they are no say zipline you see built 6 zipline distribution centers. You see bako omenako asante mampon wopsi sejuri also enum ene ketekrache a beer to be delivered near within 110 kilometers. Then 110 kilometers it be on na say baby awo bia within that space bi bia no enti e Ghana ha say na esi achiche mu no baby awo bia you better deliver emergency health service ayedai ama me na o ka say o can zipline distribution centers in abomu a omo deliver 17 million for medical supplies to Ghanaians across 13 regions of Ghana. 17 million. It is only past 17 million. The biggest question is, say yes the plan and I didn't do command and yes the plan and I didn't moja command now. And what would have happened to this 17 million on the medical bed? And so yedi adie be muntie dia NDC for ekaye. NDC hanabisu muntie wankasa for wasu tie dia hanabisu kaye when we were going to introduce a zipline medical drones.
If the drone that we all know, that I know that is what went and took the pictures of John Dramani Mahama, that has the cameras, and we have, and you are talking about women in the rural areas, then it means that we have a lot of roofless bathrooms. Last time, even in East Legon, I was shocked to find one by the hall where we launched our campaign, you know, for the by-election. And if a drone passes over any object and the person controlling the drone with the remote behind a screen, whatever the person sees, the person feels like clicking. The person will click. Now, where is the privacy policy statement regarding this? You want to bring it into the country. The US that created it, where you're going to bring it from? There are women today who have taken people and some companies to court because once they were turning on the high seas, somebody's drone passing over them took their naked pictures. And so what I was saying, that you use we women, I was addressing women. If that is it, now you should come out and give us your privacy. But if not, once I don't have it, once I'm not sure which drone is flying over me, I'll take it as the drones that also have cameras and they also fly and they take pictures. They may be going, it's a human being who is sitting behind the screen.
But you do know that not all drones have cameras. Like cameras are only mounted on the drones. So
no, it's not for me. No, it's not for me to think. It's for the authority that negotiated to tell the negotiated to tell us, and whether it even has it or not, you should have a privacy policy statement that accompanies it. So when it comes and it violates my privacy as a woman, then I'll talk about it.
Aje Ghana for 17 million enkwa. Aje 17 million Ghanaians aje omunkwa. Na say women organizer of the NDC woka say drone no Ghana for mungu na the enti a eba and say ebetwa emma ho ewe dware a. I keep telling us Ghana for health insurance me boche mo omukuti free teachers omukuti anytime I better say NDC for complaining about BBI MPP aban na say ade ebebo Ghana for. It's as if said they are on autopilot. At the end of the day, see a good crowd say dream. How can you sit on TV and say the medical drone you the check must see Aje Ghana for 17 million and kwano. That medical drone no you the about because you the be ma on the tramba pictures. This is the person and the people who are moving from your house to house telling you to vote for them. And the decision is going to be made on 7 December. You have a reason to vote right or vote otherwise. Now, wambra adie na ye na ebwa Ghana for Aje Ghana for nkwano. Ono to humpi ma ho eseno no. Umentie the United States of America Vice President Okafa zipline na ye de abon my way no. Muntie de okaye Kamala Harris. Umentie de okaye. Right now, Kamala Harris.
African nations are pioneering the delivery of healthcare supplies by drone. In Ghana, this service has delivered more than 9 million vaccines, including those for COVID-19.
Almighty United States of America Vice President Ebo Ghana baso say ade na ye no kra wiase afa na nyina no ye no ene amai kakra bi na ye di animu a ye de gini pankwa NDC 40 Ghana say ye de hwe ma ho twa ma pictures zipline omo offices ni bi o mena ko office ni se hwe oso die ni vopsi die ni tie NDC MP or say NDC MP prefers motorbikes to drones for medical supply into or say yawe boy match 3 now pe muja to moto 50 baby awo no na ride 15-20 kilometers na ko hwese mpo muja wo ho ansa wagibia eden aba omo solution no nti ye solution ni say upe moja upe anti-snake venom upe emergency medical supply na bi ni baby awo na ye the drone ebe shooty abrow in real time na dey ahwe alternative na waba ho say to obama ne say on pen no yento motorbike na yenfa motorbike no so you have a choice to vote for drones that will deliver medical supplies for you in time of need, or you vote for the NDC for motorbikes to supply a friend is saying medical need to you. South Die NDC MP Roxanne Dafia Mepo. South Die NDC MP Roxanne Dafia Mepo. The new Munsemdi Roxanne Dafia Mepo say ono ni solution na ono the party omo de ba and say yemfa motorbike mumbra na nye drones. We say yas kasa tenten like I said next chapter yen kasa nti obia yen kasa ye career he until you have a choice to choose to make between motorbike and drone. And I'm very sure say the millions of Ghanaians watching us this evening will definitely choose zipline drone medical supply system than a motorbike, because motorbike tete adwen tete nhyehyeye etwam enei efasobia entumi eniso when you compare to drones. So we need a drone option now and we use motorbike, but so we utumi dwen kan ko etire fa dwen kese, you can think big. Now you believe in possibilities there, then you can believe say drones are way better than motorbikes, and that's what we are proposing to you. UK's first medical drone delivery project will change future of national health scheme. September 8, 2022, United Kingdom, UK, your colonial masters no. UK's first medical drone delivery project will change future of NHS. September 2022. Ye dear no. Ya ye kra no. Ayakoye ni no. Afi na United Kingdom for kra eba baby. That is what Dr. Mahmoud Bawumia is proposing for the next chapter of the development of this country. Possibilities. Think big. Things that the NDC think is impossible, those are the things that the MPP believe it's possible. And those are the things we fight for. And then, Ghana, today, dialysis, aba yetuya ekane da kolebu ana ma omuntumi provide dialysis support no ye fi ho. Parliament I approve 6.87 billion for national health insurance and financial dialysis. Na yen famboa na Ghana phone to binya dialysis support when it comes to those who have kidney, and we are all aware say on my way mu na say ade aba pa ne say what WhatsApp group we na say the flyer bia betum you say obi na wunim na hu na che be hwe na na edna betum me ankasa me nuaba me ankasa me cousin kidney ekunu, and there are millions of people kidney aware how about thing and what thing onto me inti nkoko hospital no dialysis na nko betumi atena se ache, but when nya M1 ntem I don't know why when ya e betumi ahye usika gina kra, because I dia na wotwe bia esese woye why when ya betumi ahye e be hye kra, inti aban have to intervene. God being so good nyame ncha de aban na ohaw mu kra no still a opekwan obefa so de beboa ne manfo no MPP abano. We have come true for the people of Ghana again. We have difficulties. We have challenges. Of course, that's the like inflation, I'm sure. You go so I preserve every film. Exchange rates, you go so I preserve every film. And difficulties were, but in the midst of the difficulties, MPP is coming through for the needy. It's coming through for its citizens and the people of Ghana. That is the biggest difference between us and the opposition. That is what makes us different. We may have video you can say my data and statistics and so. Mo famoni ehwe videos ni bi ho na ehadwen mesra mo fa nchen ye kapo mo de ho sa mo hwe video yi mame.
The humming sound of medical equipment here at the renal unit of the Cape Coast Teaching Hospital welcoming patients. It's a Tuesday morning and 15-year-old Priscilla Santi is being wheeled into the renal unit here.
The doctors told me I have to be on the machine, and I have to be on that machine either twice or thrice a week.
And see, based on how he and in fact we cry their back kolebu back on for noche ne teaching hospitals. The bring na cash few. The bring na cash dem because on okoko te say obi tua 3,200 na what should be now ordinary reaction home. People are dying because they cannot afford. People are dying because they don't have the money. But today things have changed. Abai Edin Sakrayaba. Momenti announcement.
Vice President Dr. Mahmoud Bawumia has announced that the National Health Insurance Scheme will soon cover dialysis cases, bringing relief to many Ghanaians who struggle to afford their costly treatment. Dr. Bawumia made this statement during his campaign tour of the Upper East region, where he addressed various gatherings and interacted with the locals.
I thought it was very important to deal with the burden of sickle cell sufferers, and that is now covered. The same thing with childhood cancer. And childhood cancer is now also covered under the NHIS. One of the things that we are now starting to do, and the ministry, the National Health Insurance Authority is releasing some money for this, is to look at dialysis patients, because we are seeing a lot of kidney problems that are in there for a lot of our citizens across the country. And so what we are aiming to do is to bring dialysis treatment under the NHIS, just like we've done for hydroxyurea for sickle cell sufferers and also the childhood cancer. Now,
based on how we in our buying Debbie, we are all trying to get ourselves from the global economic challenge, but we have to be there for our people. You to be international, your man for whom you say, whilst and they are losing their lives simply because they say I want to. So we won't have been. And Ghana buying say unya kidney now we are below 18 years. Wo kidney dialysis obey ni nyina bosumi ni nyina no ebetua obey ni free untua hwe. Temesrew se wo fie na wo baby ho aka kidney yare a ebia na wonte ya madaroma ene e free e chanopa fa oba no ko nko dialysis obetimi atena se ache no so contribute to the economy of this country. Ebiem say with the 60 years and above nso a with the 60 years and above nso a kwa e be show free untu ahwe nempo mo within 18 to 59 years mko konfa noche whole teaching hospital Tamale teaching hospital Efian Kwanta hospital no 2 sessions free 2 sessions for you for a month free timesel emfa kidney ne hye wo ho wa ban no abem e de hye abeto akwemu ama wo se ese otumi ko na okoje ayaresa na afi umamko kolebu enso no 50% of mo sessions na moko per month no so abaya fa ho ketua ba mo ese wachemu kana nka mebobu emumienu na mafafa no mutua ma. This is what a concerned government does for his people. This is what a willing government does for his people. It's difficult today in the world. Things are hard. Things are very difficult. No doubt about that. Every country is struggling to get back and trying hard to get back onto its feet pre-COVID days. But this government is saying that whilst we are working at all the other things, no money na ya bobo no ye ho afiri no. Ye ntena se na ye manfo enwu esa ne se uniska esa nso ni 3,000 o de ba ko dialysis nti aban afa ho ka otua e de amaye aban asanso aye urology and nephrology center of excellence and also eboa na ahwena kidney yare edi huduma na menka se meso nkyerɛ yeah ka digitization enye abstract enye bibi e won frame mu mo kai embra na ye course hospital ye ko fill forms na o fill form bia na ya ma card na ye creative folder amount nti enei ukọ efie ekọ eyie ewo krom ukodu ye no na wo yem ka wo ukodu hospital instead of say ye be ma eduro ni ahwe ni awo wo pane no udu a afa ne ye say ko fill form o fill form bia ko yi card amount na yakoye folder asa ube wie na bebre kra ho kra say okodu hospital watena sia ma nurse fashion na ma newu eni aban eye free ho into district hospitals, regional hospitals, teaching hospitals aban epia akọ akakra aban epia akọ chips compound dia aban nyina ne say nei ukọ hospital health system no dia eye nyina ne say wote kasapin na ukọ hospital kasapin na oya card wo ho ne ye de ukọ system ni mu a eno ano no say wo be piem e wo keta na say yare bo na ukọ hospital a de hia ne say wo be yi Ghana card e bo Ghana card na wo information nyina ebe pie na menka se mi nchemo what is ankomo ni bida say obi enya accident na de do hospital no wa short moja na say ma ne moja nso na wa ye unconscious ontumi nkasa watomum na ye nim ne blood type na ye nim ne blood group na fe ne ye baba twene yakotese se monim saade no ene I can tell you say with the e-health system no e ye free ho enti e bia wo fi da mongu e na wo besen ko e ye e wo twefo praso e na ukonya akwanhie bi ye rudu hospital a ye card no ne ye hwe ne ye bo we information na be ba system nim e wo twefo praso even though wo nko hoda udin onfe wo blood group yare a wo ho endu a wutumi nom endu a wuntumi nom allergies a wo ho bibia wa yare sa ho se wo BP wo akoma yare wo ho umoja mroso ni nyina be show e wo twefo praso se de be ya sempo wato mum anade atowo so a yen kase ye twe won waso yanse hu edu e de be mawo straight away ye be hu edu e de be mawo ye be hu ekwan ye be fa so ye be krakra ne ya hwe. That is what the e-health system does. The e-health system say information unya enter no one pa bibi a obefa wa Ghana half an nyina no we information wo na nekura beta Mahmoud Bawumia de registration at birth abeka on kwa dey keke because don't forget say nay you synchronize Ghana card with national health insurance card, you synchronize Ghana card with Senate card, you synchronize Ghana card with your tax identification number. Yeah, synchronization in wie enti ya we nso ane ama Ghana card number sound number we and now the ko wiase afa na nyina enti ya we wona ya test why you know blood group ya the core system ni mu no enwu nyia se ubebo ache doctor bia biam hospital bia be ko Ghana ha nyina no doctor no onye hu wo je Ghana card number obehu blood group no information na we hu ko be fa so be dey obehwe ye wie no doctor Bawumia sign the e-pharmacy so ba enei e-pharmacy adawoma uti wudem na wa to eduru ni ye deliver eduru na yeden ama ewo fie ebusafo se wo to boase na o keka nyama ebu mu a na obehu insonso pa Dr. Mahmoud Bawumia na dan kwekufa ne MPP aban ede aba nyama ne de bebre na aka ye ntumi ye dodo na aka ensem enyensiye ne mu se wo kari na wo we na wo hwa obehu se de aye ne dross a ese ye bɔ ho ban na yetumi make sure say eno agire yie was to pursue the outstanding one. It's the impact of e-health going paperless and paperless okoye afi na okoye folder ne card ne menema improve efficiency. It's a man okos our hospitals here health everywhere waiting time no and no so queues no enwa ama clinical research ekoye because your information data bebre you bet to be Uganda ha nipa do omunya malaria last month nipa do enya fever nipa do say enya say all at the same time because it's connected across the country and reducing rejection of claims by the National Health Insurance because first you say na hospitals ni bi ye kunulu ebi mu ye ketache senti omo de ade ne kwa health insurance na che da bi ene because of the e-health nti obi ehu obi ade de ni hu bi untumi ye bibia amfa chire nti ama eno so eboa na health finance eno so akọ entem afa aboa ema doctor for nurse for ye nyama pepe when it comes to protocols so we save life like I said sade atomi so ye de back hospital that's a doctor no oni me blood group that's a me moja just oto no boase na oba hihye nyama enei onya bo me information na me details ni naba nti time na nka first obe waste no da hwehwe nyama ni nyansa wa behwe me no eni eswate obetumi ahwe me ententem and afei so no and this is a very important point track some core parameters which benefit our people, like availability of empty bed. Into a son is our e-health system. Hospitals are connected. It's a doctor, all show now, only say, SM refer course St. Joseph, no system, when the Mumpadoa, it was St. Joseph. When the hospital, a wampa, any hospital, any impa. When the hospital, a wood way, any hospital, any way. When the hospital, a one specialist way, any hospital, any specialist way. And that is the next chapter of Ghana's development. Dr. Mahmoud Bawumia say, we need to finish this. This has to get to the church compound level. O church compound level community, o church compound level ukromu o church compound level ekrada se ho no ese sa church compound so beka e-health system nim na yetumi nya no prakope. We cannot truncate this progress. We cannot go back. We must finish this, and that is why we need to vote for Dr. Mahmoud Bawumia come December 7th 2024. Bushafo there was special interventions bebre aban yi baye odiaba ekufo ado aban several critical interventions. The notable pa University of Ghana Medical Center phase 2. Ye ba aban mu no na Professor Mills ahase University of Ghana Medical Center. But obaye no oye 1 pe oye phase 1. In fact phase 1 no omampinda da John Mahama betoye nti obaye no so beto aso ono kwa wenwie nti omampini ekufo ado so baye no wanto antwene say Atamils de hase na Mahama beto aso nti oto atwene na nadan ekufo ado ewie phase 1 no prekope owie no amana nso wa o make sure say or the phase 2 no of the University of Ghana Medical Center no be den ebeka ho nti no ko University of Ghana ya ye phase 1 no ya bewie na ya sans wa hase from phase 2 ekufo ado yobi a anko on fa University of Ghana phase 2 ni see University of Ghana, but on fa politics ending in Mkai. You could have taken that project to anywhere else, but to this University of Ghana campus war, just to ensure say University of Ghana Medical Center no betre I enhance it in training of medical professionals. Now a center of excellence for our health facility. And okwa kama almost contributing strongly to your medical tourism on my way. And again, also your second phase of University of Ghana, University of Health and Allied Sciences. And what these things are doing is these facilities, training of doctors, any other health, allied health professionals, and abai asanso introduce training of specialists. And what this training of specialists in say one shortage that you work in the specialist healthcare space my way no akwedim na ade bakwa den say specialist bia ye training no my way bia no MPP abai aye free. Until all these specialists are being trained for free. We may have video quickly on University of Ghana Medical Center. Phase 1 no for the buy and a phase 2 no or study phase 2 no ebeka ho where your University of Health and Allied Sciences are na nadan ko for the phase 2 abeka ho and no it provided the critical training for your health professionals on my way now we have project here aban we atamasi ho na wasan ahyemu kena na ebwa we need to finish this. Let the MPP finish this. There are difficulties, there are challenges, but let the MPP finish this. Yeye we nyina yi omampeni hukeni ye first lady Mrs. Rebecca Kufuado na ono so nam na obwa ode na hoden ta aban ni ku echi eye no ma hodo bebre ewo ye apomode ehonsam. And through various initiatives and advocacies, we championed maternal and child health, improved access to medical services, supported healthcare infrastructure development. Significantly, we contributed to the overall well-being of Ghanaians when it comes to the healthcare. Madam Rebecca Kufuado, the leadership when it comes to mobilizing resources, me yet municipal chief executive with Equiapem North. Madam Rebecca Kufuado, Emma Equiapem North, or my medical supplies be and then call at the health center, X-ray machines, name machines be Sisu Unai. Madam Rebecca Kufuado, Enna, Edema, Latte Health Center, Tetekwashi Hospital, and several of our health facilities Equiapem North. Oko Equiapem North, as I speak to you, she's putting up a CHIPS compound in one of the communities for the people of Equiapem North. And that is what she's also been doing. Or refurbish Usu maternity home. She's built Sunshine Hostel to accommodate children receiving cancer treatment. Any of my families, our Kolebu Teaching Hospital in Kola, and you can see cancer running through all the efforts that the MPP government, because it's expensive to manage. And if government doesn't support them, it will be difficult for them. The First Lady has built the Sunshine Hostel to accommodate children receiving cancer treatment. Any of my busia for Moka Hospital or Kolebu. She's built the state-of-the-art mother and baby unit at Kofanoti Teaching Hospital. Constructed CHIPS compound in Kobebi, Nyanshegu, Kwaminum, Adankrebi, Biampa, Meme constituency Kra, Ebi Rebecca Ekufu Addo, Sunshine House. This is what the First Lady has been doing in the health sector to support the government and the people of this country. Umpewi. Na opedeng mobeka 2020 wabra on my way afan into my pefra ayesi kwampa so ayenam aye chese yeni agea. In fact, 2019 is said to be one of the happiest Decembers we ever saw in this country, so many years before then all of a sudden, out of nowhere, you were somewhere February March, you see your body be a friend of COVID. Nobody knew what COVID was. You need to cry and fire in Tifa. But Ghana was adjudged one of the best countries, one of the countries that best managed the COVID situation across the world. In some other countries, people were dying. In fact, in some countries, at some point, they left people of certain age to die because there was no space to keep them. We shut down our economy. We shut down our country. We closed down our schools. Ghana, we had to recruit more health professionals when we had not budgeted for them and had no money for them. We had to incentivize our frontline professionals at a time when we had not prepared for it. Our economy and our society was disrupted. Now me MC, every baby no, yenam schools in the airport, which was a woman from dormitories and your isolation centers. Empo say obi ye asymptomatic and onya COVID no show symptoms. Ne person isolate here. As an MC, the district or the municipality, your top provisions and the Duanemano, your man on Paduane, a Viaduane, and Adriani, a Winifie. No what top provisions now they are common. We struggled to ensure that we contain the COVID situation. Hospitals didn't have enough beds. We were using hotels to keep people. COVID, Emma you say the much touted health infrastructure na NDC focus on my nano. It was a complete facade. So we don't see the gap that was in existence. COVID, MMA who say, hey, so my 88 of your district need hospital. 88 districts did not have hospital in this country. Meanwhile, you say CHIPS compound, health center, clinic, polyclinic, and a district hospital. Every district must have a district hospital. Imagine this: a free Okre district assembly. Obaba Equiapem North, Waba Equiapem South, Waba Adenta municipality, now Waba Madina municipality. 1, 2, 3, 4, 5. all these district assemblies, we had only one district hospital, Tetekwashi Memorial Hospital in Ekuapem North. And see, Obi Yare or Madina, not per district hospital, not the Numachi Ekuapem North, Adenta Ekuapem North, Ekuapem South, Ekuapem North, Okre Ekuapem North. And yet, the Tetekwashi Memorial Hospital itself, the number of beds or one is so the pressure was enormous. During COVID, we realized that this country was not ready to ensure that we safeguard the health of our people in times of emergency. We didn't have any, what you say, yeah, ready cry. Now, meaning say, yeah, you're if you COVID situation now, and I don't know if we have some videos on COVID that you to me sure. If we have, let's just show just some few seconds of the COVID situation, and then we'll come back to the conversation. Isolation centers, makeshift isolation centers, and we had to create at that time. This is what we had to be confronted with. Government had to overspend, overrun our budget. It's just say we had to do everything we had to do to save lives. Our doctors and our nurses had to put their lives on the line. Your doctor for the nurse will be almost sure in the process of saving lives. We have families and friends. That is how difficult and how tough it was for the world during the COVID period. Countries like Italy, countries like Spain, at some point they were allowing people of certain age to die because a friend is saying space and it was a difficult period at that time. It was a difficult period for us as a country. Patients were sleeping in classrooms. Patients were sleeping on floors. Children stayed at home for a year, and we still had to pay teachers and still had to make sure that these children had some interventions. This is what brought about the need to ensure that the call through 2020 no nyamin pengu obi nim there baby by a sign bar. We have to be ready as a country. Now the WHO crab boy abaso. You didn't say your video no and our pictures no but the WHO actually said when it comes to this country, Ghana, a quiet first way to manage COVID down a year strong. We want to mention the WHO video no quickly.
The coronavirus pandemic so far, with Ghana's testing capacity especially singled out as one of the best in Africa. Government has received praise and criticism in equal measure for its methods in dealing with the crisis, with the opposition saying government has been slow. Well, the government has rejected that claim, saying WHO Country Director for Ghana, Dr. Nima Kimambo, has also been speaking exclusively to Joy News on this.
As you have seen, the government has been providing a lot of briefings on the situation of COVID. The daily numbers are shared, and we think this is a good thing for countries to be transparent, and the fact that even these numbers are shared daily on websites. The government continues to do testing, and it's also Ghana is also one of the countries that has done among the highest number of tests, and this is good because the more you test, then you are able to identify cases and you're able then to isolate.
Based on sa situation here COVID by NT, Nana Dankweku Fado announced in the middle of the crisis, and that's what I keep saying. Say that is the biggest difference between the MPP and NDC. In the midst of the crisis, we didn't throw our hands in the air. And Fadika said, no, we cannot continue like this. We need to ensure that we fix this infrastructural fundamental gap once and for all. This should be a day. Say the will be in the district in code district for be a day. Some a health system, no. Until you make sure so be a obi. Not obia the training important for because it's very painful. Say the word district A. Now me who can make hospital or me district. Now why am I because other people from district B and C aba. So we needed to fix this. And so Nana Dankweku Fado announced in the middle of the crisis, that we had to ensure that we put up infrastructure at all the district hospitals 88 now we realize that there are certain regions in the regional hospitals so there are certain mental health hospitals also so that once and for all we can fix our infrastructural gap. This is the most audacious investment in our health sector when it comes to infrastructure since 1992 at least. No government since 1992 has pursued such an audacious investment like we have. Yes, you know, as usual, just as they always say, Agenda 111, constructing over 80 hospitals at the same time is unreasonable, Mahama. Everything is impossible for them. This is the Garu District Hospital. Yaboso. Yaya fittings. Yaya finishing. This is the Abumosu District Hospital. Okre District Hospital. Okre the Miami Krum. And now Omaye installing beds, medical equipment, and inside Nukra Dada. Achiase District Hospital. Akim Swedro District Hospital. Now the NDC are telling us say it's an say 111 and I say 88 District Hospital. Yenti. But I can tell you say each of the 88 district hospitals are at different stages of completion. I'm coming say na or can see be in 18 months. I na miss our question. Tema West. Eka district no money hospital no. It is Umunya hospital. But what the withdrawings are Okwakosi district hospital we did Tema West. We do Tema West we say landa yede be yes our project no. Anyhow. Tema West needs a district hospital, but they don't have the land. So what would you do? You have to spend time to look for the land. It's all toboas in our past. Some of them, like Tema West in Podier, it's an assassin nuanti, assassin obejano, and yet can see it senior plan is it no. Until I say, taking cap people no sign so much. No more sign best drawing no. No more draw building a best city Tema West for assassin. Wako adeso Upper West Akem. Ukosi District Hospital, Ukoyano, Assassina district in Maono. There are rocks, big rocks in the land. So it takes you about 3-4 months before you're able to prepare the land and take off. Then Ubiabe catch. If there are even some districts African land, you know, are available. Then Ubiabe catch say it's not the case of 18 months when we enti. You are in Ebugos. Ebusia history will forever remember this government. That there was once a government that decided, say, district be a Ejana hospital. And the government went ahead to make that investment to ensure that every district in Ghana will have their hospital. Posterity would always remember this government. Yeye ni nyina na yeye recruitment. As we speak, 152,472 health professionals in our byway if 2017 eba 2022 mpo aban we are recruiting 152,000 every year. 2017 10,000, 2018 11,000, 2019 40,000, 2020 58,000, 2021 26,000, 2022 6,780, 152,000 health professionals. The aban ya say or per se ye a lot more health professionals ba na a reduce nipa dodoa ekobo peso eko doctor ba ko pe won nti enyi me no ka say doctor to patient ratio between 2009 and 2016 as at 2016 na 8,301 enyi it's the number of health professionals aban we afa abaye health system ni munti eko 4,992 emu ache mienu ye reduce doctor ba ko nipa dodoa ohwe do achemu mienu. That is the impact we are giving to our health sector. Nurse for 1 to 834 and then 1 to 524, almost about 300. And I buy at TF nurse back also. Now the nurse be abe ababeka ho. No just call card no. Doctor strike is illegal. We can't negotiate under duress. MPP is recruiting. NDC is complaining. MPP is picking them. NDC is complaining. And 2016, a medical officer on the number around 5,200 salary, and they abaya to muko 3,406 or 2 more first year house officer na the salary na be 2,800 Ghana cedis ene aban de ko be 8,800 Ghana cedis. Physician assistant na on the be 2,500 aban double no ko 5,000 Ghana cedis. Registered nurse na on na be 1,900 ene aban de ko 4,000 Ghana cedis. MPP aban improve yen conditions no na mahama mom warning say oni omo ni kase bia ni nkobodie bia oni omo ni bibia omo beka. That is the biggest difference between the MPP government and the NDC government. This is our report. This is our scorecard. 111 hospitals under construction, 6 zipline distribution centers that have so far provided 17 million Ghanaians with the needed medical support, 424,000 medical deliveries made by zipline drones as at August 2023, 3.3 million units of medical product delivered nationwide by the zipline drones, 2,694 health facilities onboarded on the zipline drone services, 10 million vaccines delivered by the 10 million 579 vaccines and a zipline drones deliver on my way. Hard to reach health facilities are in zipline SAB nkrase chips compound ne health centers a way cheaper zipline a supply on nyama over 400. Yeah, the ambulance 307 and aba ambulance stations no yeah the bebre ababe count about 297 and yeah the ababe count ambulance service response to cases economy preocupe. National health insurance a movie from 11 million equal about 17.2 million. Ladies and gentlemen, this is our scorecard. This is why we believe we are a better alternative to the opposition. There are a lot of challenges, there are a lot of difficulties, but this is where we are. We need to protect this achievement. We need to consolidate these gains. And the person who would help us consolidate these gains is the flag bearer of the New Patriotic Party, Dr. Mahmoud Bawumia. Dr. Mahmoud Bawumia say, "Yemano kwan na enepa ya shase ye no. On fambe to aso no mewie. Yemano kwan na oma ambulances ne bi embeka ho. Yemano kwan na e-health system no ombie mu na enkodu the chips level. Yemano kwan na doctor to patient ratio no ye improve no. Yemano kwan na ambulance to citizen ratio no yefambra below the 25,000 global standard. Yemano kwan na protected the health and the life of the Ghanaian. He is making a solemn promise to us. Say, there were difficulties, there were challenges, there were a lot of challenges as we speak as a country, just like all other countries. But he's making a solemn pledge to us. Say, in spite of these challenges, in spite of these difficulties, in spite of all the difficulties that we are in as a people, he's making a solemn pledge. Say, he'll protect our health. He will be there for us. He would ensure that no Ghanaian loses his life, 1, because he doesn't have money, 2, because there is no health facility, 3, because we didn't create the needed space for this Ghanaian person to have access to the needed health service. This is the next chapter of Ghana's development. Dr. Mahmoud Bawumia is promising. Ebusiafo, Machel, the scorecard. Very confident in it. No insult, no propaganda, no twist, no skill. Pure fact and numbers. I can tell you, say, you have done more for health than the NDC have done. It is a Okotuaba, now to Dr. Mahmoud Bawumia and John Mahama, Ewo ballot papers. You have a reason to vote for Dr. Mahmoud Bawumia because you can trust him, you can believe in him, and you can be rest assured, say, Obe body aya no hobai na ODB ababeka. Echina, Yamiya Adoma, Dr. Mahmoud Bawumia ekopiemu ewa Ashanti region. Echina Juada, Ebnada, ene Wukwada, one Asanteman ebenyan kitangudie stronko, ewa ne campaign na oyenim. This is the 16th region awako, so far wako 15 region. I say no yenu wo baby ano, in Ashanti region, one edwedifo bedi nkomo, one magazine fo bedi nkomo, one ekuafo bedi nkomo, one school fo bedi nkomo, one asofo obehia, one nananom behia, na ne emrantie nso ebehia, na ode ne dachi a odwin ewo magana no ode ama ɔde ama yɛn na no crepa ne sɛ wode wani ato fam a ɛberɛ Dr. Mahmoud Bawumia ɛni abere a ɔyɛ campaign a ɔwura house to house door to door or campaign no na John Mahama complaini na yɛ kan sɛ complain nti afei deɛ ɔtwa skit nti sɛ mohu fiti andra a ɔnam abɔnten na microphone na yɛde twa movie wɔ kuma wood no tententen no ebi da no so na obeduru hɔ sɛ wotɔn ade a na obedi na yɛde agye wɔ so asɛ ɔyɛ skit no na ɛnyɛ agorɔ ne yɛdi Ghana daakye ho nkɔmmɔ ne yɛdi ma mo amohu 2003 yɛkɔ ɔmo de health insurance